Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today I'm at Morton Comprehensive Health Services, and joining me to talk about influenza is Dr. Kelly Humphreys. You're in family medicine. Welcome to the program.
Well, thank you for having me. I appreciate it.
Now, before we begin, I want people to understand, what is family medicine? Who do you treat?
We treat everybody, full spectrum, from birth till 105 years old or older.
Okay, now in that, do you tend to refer people out if they have certain health conditions, or as a family medicine physician, you pretty much can handle everything, whether it's diabetes, whether it's asthma, whether it's sickle cell, the whole shebang?
For the most part, we can handle a lot of disease processes. There are some times, for instance, if they have a compound fracture, they might need to go to an orthopedic surgeon. Okay. If they have a certain type of cancer, we might have to refer them out for specialty treatment. There are times when we do refer out, but we try to take care of the patient, and you know, we get our name Family Practice because we try to take care of the whole family. Mom, dad, the children, grandma and grandpa, everybody.
Okay. Now let me ask this question, because people may wonder, in the referral process, if you have to refer out, how do those other referring physicians keep in touch with you as the family medicine physician? Because in essence, you're kind of like our primary doctor. You're our main person. So how does that communication still occur so we feel that there's some continuity of care here?
Well, this is really important, and this is actually part of the national debate right now for healthcare.
Okay.
There's a big push in my national organization, which is the American Association for Family Practice Physicians, that is talking about something called the medical home. They want every patient in America to have a medical home. They want one physician to manage all of their health care needs. Mm-hmm. So even when they go out and have, you know, a specialist look at a problem, all of that information comes back to a centralized location. One physician oversees all of their services and all of their treatments. I think this is very, very critical, because I have seen patients come in who have had numerous tests done by several different doctors, mm-hmm. all looking at the same problem, and there's no one center doctor looking and managing all of that treatment. So we're looking at cost, but we're also looking at what's best for the patient, and certainly it's not good for a patient to get 3 or 4 CAT scans and be exposed to all that radiation.
Right.
And it's not cost effective, and if you've got one doctor managing that, that helps.
Now, in that same regard, I would think it would lessen error as well, because we know that there can be a lot of medical error that occurs with patient care, so this would help to minimize that.
It certainly does, and that's why I really like what I do. I like taking care of patients because I know them. Mm-hmm. I know them, and I know what medications they're on, I know what tests they've had, I know their background, I know their allergies. When they go in the hospital, I know what surgeries they've already had, mm-hmm. And they feel comfortable with that. I feel comfortable with that. And yes, at times when I've had a patient in the hospital, when emergencies have arisen, I've been able to help facilitate treatment because I knew them.
Right, and I would think too that would help with compliance a great deal, because if I'm coming to a physician such as you, and you know all of those things about me, and you've been treating me over my lifespan basically, then you kind of know what I'm prone to do, what I'm prone not to do, and how you can help me put that in better perspective for what I need to do.
I agree with you. I think that's exactly right. And so I'm very excited about this concept of a medical home. President Obama has talked a lot about this. Mm-hmm. My national organization is pushing for it. The American Medical Association is also pushing for it. So I'm hoping that this will be part of the health care bill when it comes down through the Senate and the House in its final form.
Okay, well, let's switch to our topic of looking at influenza.
Yes. Now,
I want to frame this as influenza in general and look at specifically in terms of H1N1 or seasonal mm-hmm. flu as those strands of influenza. When we talk about influenza, some people may wonder, what is that global terminology of influenza?
Influenza means a viral flu. There's been several different types and strains. All of them are viruses. Mm-hmm. All of them cause fever, body aches, usually upper respiratory symptoms. Most of them are seasonal. Because they're all viruses, they tend to be transmitted most easily during cold weather, when we're inside, usually through the air. When we cough, we sneeze. It can also be easily transmitted by our hands or touching something that has the virus on it. So they have a lot of similarities.
Okay. Now, when we think about a virus, help us understand, because some people will think about a virus and a bacteria. And you may hear, we'll talk a little bit later about the other kinds of treatments, but I want to focus on this one. Some will say, well, if you have the flu or influenza, you need to go get an antibiotic.
Yeah.
But so talk to us about the difference between that bacteria and the virus and the role of an antibiotic.
Okay, well, it's interesting because in microbiology, if you've ever taken that in high school or college, you talk about what is a bacteria and what is a virus, and they are two very different microorganisms.
Right.
And we have different medications which treat both, okay? Antibiotics are only good against bacteria. Well, we have really good antibiotics for bacterial infections. Unfortunately, I guess in a way, influenza is not a bacterial infection. And why I say unfortunately is because we don't have near as many treatments for viral infections.
Okay.
We only have currently 2 types of medication that we can use for influenza. And it's very limited. Tamiflu and Relenza.
Okay.
That's what we have available right now. Both are fairly expensive.
Okay.
And both of them need to be started within 48 hours of contacting the flu.
Okay, and we're going to get more specifically too with what they do and what they don't do and those kinds of things. But so people understand, if you've got a viral infection going,
yes,
viral syndrome,
antibiotics will not help you.
Will not help that, and because sometimes people think, well, my doctor needs to give me an antibiotic. Now, in terms of transmission, before we take a really quick break, you did talk about influenza being spread like by coughing, sneezing, that type of thing. Some people may wonder, doctor, well, if I'm talking to a person that has influenza, am I going to get it?
Well, you could get it. We notice that people tend to transmit it most easily to other members of the household. And when they're in close contact with people. That can be people in the same classroom, people in their workplace, or people sharing, the same house. That's why we urge people who have fevers and coughs to stay at home. If they're sick, don't go to work. As long as they have a fever, and stay home at least 24 hours after you are fever-free. If children are running a fever and have a cough, keep them home from school so they don't infect their entire classroom. And it looks as though, particularly with this new flu, the H1N1, you are contagious for up to 5 days after you are acutely ill. So that means you're going to be sick for about a week, or infectious for about a week.
Okay, and we're going to take a really quick break and come back and pick up on some more of those signs and symptoms. Okay? Please stay with us. We'll be right back.